Okie doke. Here's a video for training the leg stability. It's preceded by a more less demanding exercise regimen where the person's lying down. There's 3 hip exercises done lying down, and then a whole leg exercise done standing up on where you squat down to a chair. So that series of exercises are done 3 sets of whatever number you can get through in a minute, but 3 sessions of that with a half a minute between each session, 1 time a day. And those are good to do 1 set of before you do these exercises because it wakes the muscles up. And the reason there's a big focus on the hip muscle re-education, hip muscle strengthening, is it determines the posture of your leg significantly. So good leg posture means that your joint doesn't have to, means your joint's more stable and operating properly. So there's going to be 4 exercises here, ones that carry over from the first series of exercises. It's just a chair squat. And then there is going to be a lunge and a sumo squat, and then a hamstring exercise. I have an interval timer here, a free interval timer. I'm going to make it real simple. It's just going to give me a minute to get as many exercises done as I can, and exercise reps done as I can. And then it's going to give me 10 seconds to switch to the next exercise. So I'll be talking about little details about how to get these done in the most beneficial way as I do them. So you can play this along, and if you go through it another 2 times, just rewind and play it another 2 times. Here we go. Chair squat. Here we go. Down 2, touch 2, up 2. 60% of the weight through my heels, 2, up 2. 40% through my forefoot, down 2, hold 2, up 2. Sticking my chest out more vigorously, not quickly, but more vigorously as I go lower so my spine doesn't C-shape on me. Watching my knees, 2, down 2, up 2, to make sure that the distance between my knees remains the same as I do this, as opposed to going down and my knees sinking toward one another and my thighs propping themselves up against one another, as opposed to my knees wiggling on the way down and the way up, and opposed to them bowing out. Okay. 60% of the weight through your heels, 40% through your forefoot, lined up legs. Next one we're going to do is a sumo squat. So I'm going to take the chair away. It may work out that I can go down lower, but we only go to the edge of sensitivity of our joint pain. Sometimes if your joints are really sore or the irritation lingers for more than 15 minutes after, you don't even go that far. Wide stance, feet toed out as what is comfortable. Hands like this so your chest stays up, down 2, hold 2, up 2. 60% of the weight through your heels on this one, down 2, hold 2, up 2. As you go down, you stick your chest and your backside out so your spine doesn't go into a C shape. And I mentioned earlier, the distance you go down is short of or just up to the edge of the irritation in your joint you're trying to get rid of. If the joint's freshly hurt, you're going to want to stop short of that irritation point. If the joint's been hurt a long time ago and isn't overly sensitive, you can go up to that irritation. When you're done your exercises, it should take you no more than 15 minutes to get over that joint irritation. And it should never exceed more than mild to moderate. Those are my squats done, my sumo squats. Lunges, lots to talk about here. Take the affected leg and step forward with it, and then descend vertically. So I'm going to explain my forward shin. My forward shin is vertical here. Okay, it's easier on the back side of my kneecap. I'm going to do a wrong repetition. Here my knee goes forward and I have a forward slope on my shin, and that's going to load the back of my kneecap. If you have to put your hand lightly against the wall to do this, that's quite okay. But over time, you want to be able to do it and do it with your balance on your own. Because restoring balance helps knees operate better. You can make it more difficult by taking your hands away and putting them on your chest. You can make it easier by having your hands out and use that to balance you, and everywhere in between. Pacing is still the same, down 2, up 2, back 2, and the depth you go is the same as the way I mentioned earlier. Now, I've got a simple set of elastics from Canadian Tire. I'm going to sit, and I've got those elastics attached to a support for the basement. I'm just going to pull my heel up underneath my my backside in this chair here. I have quite a few bands, and I can make this harder or less difficult by attaching more bands or taking away bands. Like the exercises I mentioned earlier, you're trying to find a resistance that you can do proper form with, but the last 3 or 4 repetitions, you have to think about what you're doing and try mentally harder to accomplish the repetition. That's an indication that your muscle has been taken to fatigue, and that's going to cause the muscle to change and grow and strengthen. Okay? Pacing similar. This one generally does not cause irritation. And strengthening your hamstrings is a great way to use your hamstrings to compensate for an anterior cruciate ligament that is a little bit laxed. I'll show you 2 other ways to strengthen your hamstrings in case you want to increase the number of exercises that you work your hamstrings for. So, one type is all you need is a pair of slippery socks and a slippery floor. This is kind of a tough exercise. But you may find it useful. I'm going to expose some slippery floor here. I'll do my timer again. Anyway, it's going to count me down. And I'm going to do a bridge. I'm going to stick my chest out and my stomach out so my spine's secure. And I'm going to pull my heels in and I'm going to push them out. In, out. This is tough. The slipperier the floor, the easier it is to do. And when you do it, try to make sure your shins are vertical and you don't put yourself into frog leg position. That's not going to work as well for you. Chest out, stomach out. Okay. Do a size of movement that you can cope with and a pace that works for you. And like I said, I'm finding this hard to do. If I had a slippery surface, I could do it a bit better. And I'm checking out the clock and making sure it's running out. Again, slippery surface, or what you can do is if you can't make it to the end of a minute, give yourself a brief rest and resume as soon as you can. And keep track of your progress and how much your muscles are strengthening by keeping track of the numbers you do in a minute. Because as your muscles get stronger and more capable, the same effort is going to give you more reps. Another way to do it, put your legs up on a ball, hands out wide, and pull the ball beneath you. Okay, easier, less resistance than the previous exercise, but a little more of a stability challenge here. Make sure you keep your knees the same distance apart as you're bending and straightening your knees. Check every now and then to make sure you're not sagging your back, because we don't want to cause a back irritation here. It has a little bit of an advantage in that you have to work balance in your stabilizers, in your hip muscles a little bit. You can choose a range that you can do successfully. If you can't put your knees completely straight because of irritation or weakness, stop short of that point and then explore that and improve over time as your muscles change and are more capable. There we go. And then, for a lot of people, I will give them balance exercises to do. Now, you notice I didn't have any shoes on when I did this. I kind of like to do that because I'm familiar with these, so I like to watch my foot posture myself and not use shoes to keep my foot posture proper. But when you're starting, and this isn't a familiar gig to you, you should wear a good running shoe so that your foot posture is proper. Balance, what you do is you think of your foot as 3 points of support: the joint of the big toe, the joint of the little toe, and the heel. And you can do things like a simple stand on one foot. If you find that it's easy and you're not getting much challenge, so you don't have to correct much, you can make your balance a little more challenging by not having your arms help you as much. You can hug yourself like this. As you're doing it, with a target of 20 seconds, you want to challenge yourself so that your ankle is making corrections over the 20 seconds, but you're not so overwhelmed that you're putting your foot down all the time. You can do other things. You can put a bit of yoga into it, like that. You can put your body in a different attitude, like that. You can put something underneath your foot that's soft. That makes it more challenging. And then when you progress that far, you can then make it easy again. Get your hands out, get yourself on a stable surface, and work on eyes closed. Because when you take away your visual cues, the challenge goes up a lot. And then you can work yourself up through that progression of arms out to close to really close to unstable surface with eyes closed. So I hope that's helpful to you.